I'm going to talk about kind of my unconventional journey in veterinary medicine. And the reason I have chosen to call it unconventional is because up until I was probably about 29, 30 years old, I didn't really ever think of entering the veterinary world and finding a profession there. I was living in Colorado at the time and, waiting tables and, just kind of having fun and being in my 20s and wasn't really sure where I wanted to go or what I wanted to do with life. I had gone to and gotten a bachelor's in psychology when I was, just out of high school, but, never really went anywhere with that education or degree. And so I was actually sitting on my couch one day and I saw a commercial come on for a Bellray Institute of Veterinary Technology. And it kind of piqued my interest. And I decided to look into, what is veterinary technology? Is this something that I would be interested in? And so I ended up calling the phone number on the screen later that day and did a campus tour. And, within the next couple of weeks was enrolled in the next session of classes. So, I wasn't one that had always had aspirations and dreams to be in the veterinary world, but have, found great passion in it and have great career opportunities. And I'm very glad that I ended up seeing that commercial so many years ago. So basically just an overview of what I'll chat about is, kind of my time at Bellray and, what the program was like. And then my first job here at Angel Animal Medical Center as a veterinary technician in their clinic department and my journey there into now being a manager of some fellow veterinary technicians. So that's where we'll go. So starting off at Bellray, it was a very unique school situation. It is dedicated just to animal technology or veterinary technology. That's the only programs that they offer. It is, a one building education, classrooms, campus, and then some smaller buildings where the animals were housed that we, took care of during classes and everything. And the way that it worked was it was 7 quarters of didactic learning. So lots of classes, book work, labs, where we all, kind of formed bonds and made study groups and, kind of made it through together. And then at the end of the 7th quarter, there was a huge practical exam that they had us take before internship. They just wanted to make sure that, we were ready to be out in the veterinary field, or we had learned everything that we could learn, doing the book work and testing. And this practical exam was intense. There was 3 or 4 education, classrooms that had different stations, probably about 20 to 30 stations in each room, each with one question at a station, ranging from, a multiple choice question to standing in front of one of your teachers and them asking you to restrain a patient in right lateral, and patient being a stuffed animal, to just many other different things that we had learned throughout our career. And you had to pass that with a certain percentage in order to be able to move on to your internship. So luckily I passed. And was able to move on to internship, where we, it was a 40-hour a week. That's all you did. We didn't have classes during that time. And I had chosen a small general practice that did, your basic general practice. They ran labs in-house and did a few procedures such as dentals. If there was any type of surgical procedure that they needed done, they had a traveling surgeon come in. So definitely got to peek in and witness some cool surgeries in my internship. And then they also had an ultrasonographer come around, once a month or so, as soon as they had enough ultrasounds. And so got to witness some of that as well. So it was a really nice, well-rounded internship and kind of got to see the ins and outs of general practice and, started learning restraint in real life situations and, drawing blood and phlebotomy, and they did have a boarding facility as well. So walking the dogs throughout the day and everything like that. So it was nice and well-rounded. And then, once your internship was over, you graduated. And so after graduation, I kind of wasn't sure what I wanted to do yet, but I knew that I wanted to move back to the Northeast. I had been living in Colorado for a long time and wanted to move back closer to family. So I moved back home, and probably the best small town story of my life is that my mom was, and I small town. I grew up in probably a town of about 500 people, so extremely small. And my mom was walking down the road one day doing her daily walk, and someone stopped to chat with her, and they were talking about their kids. And my mom had let her know, that I had just graduated from Bel Ray and was looking to become a vet tech and moving back home to the, Boston area. And this woman was like, oh my goodness, my daughter is a veterinary technician supervisor over at Angel Animal Medical Center. So she gave my mom Kristen's email address, and I was able to get in touch with her and kind of have some contacts back on this side of the country before moving home. And Kristen really helped me at Angel, and I was able to get a job there, not in her department because she didn't have any openings, but I started in what was called their clinic department, and this department kind of helped every department in the hospital, you could say. They helped the interns with their outpatient emergency treatments, as well as helped the general medicine department with their treatments, drawing blood, giving vaccines, and we're kind of there. There was a lot of restraint practice, which was amazing. I'm really thankful that I started in the department because it gave me a very good base for my technical skills. Something I always tell everybody is that restraint is the number one part of our job. It is you maintain the safety of everybody that you're working with. And if you don't have good restraint skills, people can get hurt. So I was really able to hone in on those skills and I shouldn't say practice, but learn in live situations where patients are coming in scared and potentially aggressive, and learning how to deal with those in a safe manner for myself as well as my coworkers. Got some great phlebotomy training. And by the time I moved into a specialty department, I was very confident in my phlebotomy skills, placing catheters, drawing blood out of the jugular vein, all of these things. So two, really cornerstone skills for veterinary technicians, I was able to really grow leaps and bounds with. We also did admits and discharges. So that also helped me learn more about different disease processes. As you're discussing with the owners, the at-home care after a surgery, you learn about the medications they're taking home, wound care that they'll have to do at home if there's any, and all of that type of stuff. So I really gained a great knowledge base starting in that department. And then as I, became more skilled and seasoned in there, I started triaging patients as well. So for those of you who don't know, Angel is a 24-hour emergency specialty hospital. And so anything can walk through the doors on an emergent basis, and you never really know what you're walking out to when you go to triage. So again, started to develop more critical skills, critical thinking skills. Does this patient need to be in the back with a doctor immediately? Is it stable enough to wait with the owner before the doctor is able to come see it? And so again, kind of started building more in-depth skills for the triage process. And at Angel, we are a teaching hospital. And so, being the triage technician, you're running a patient back, you have doctors surrounding you, and you bring the patient back, and they're just firing questions. And sometimes, I had to remind them, I'm the triage technician and I haven't had the schooling that the interns and doctors have. So I don't know the answers to these questions, but if you're listening to the questions that they're asking these interns and the people that are learning, and you're listening to the answers, you're building knowledge as well. And so, you start to learn the answers. And the next time that question is asked, maybe you can answer it instead of the intern, and you can help teach the interns as well. So just really gained more critical thinking skills doing that triage process. And then after a couple of years in the clinic department, I decided, I wanted to specialize in a department, and I wasn't exactly sure where that would be, but there happened to be an opening in the cardiology service, and that's where I found my love and passion for cardiology and the heart and all of the disease processes that come along with it. Um, so started to build a different skill set as far as dealing a lot more with client communication. The doctor's asking us to relay blood work results and, field any questions that these owners might have as far as, how do you take a sleeping respiration rate, and explaining that, and, what does this medication do and how is it going to help my patient? And of course, the doctors would never ask us to answer any questions or that we weren't comfortable with or that we didn't know the answers to, but they would give us the background knowledge and, always told us that if it is never an issue to say, I'm sorry, I don't know that question, the answer to that question, but I will find out for you. Because obviously these owners have much more in detailed questions that the doctor would have to answer, but it was kind of our job to field those questions. And just learned the in-depth ins and outs of the specific disease processes, heart failure, dilated cardiomyopathy, all these different diseases that deal with the heart and how to treat them and how we can help our patients. More job duties were filling prescriptions and making sure that these owners were getting the medications that their patients needed in a timely manner, and understanding the directions and understanding, that medications are a very important part of taking care of these patients and that we don't want any mistakes. So just being very thorough when filling these prescriptions. We also were in charge of, helping with minor procedures, abdominocentesis and thoracocentesis. Helping them pull the fluid off the abdomen and the chest area, either whether it just be for restraining for those procedures or, even helping in minor ways for them. The more years I had there, in that department, the more I was able to do as far as more of the specialty procedures, as well as surgeries. We helped fix patent ductus arteriosus, which is, holes in young puppies' hearts, and being able to put a device in them so that the hole is no longer there. And, after a 6-month year recheck, these guys can live, a full long life and we don't have to see them anymore. So really helping them. We also did balloon valvuloplasties where the pulmonic valve doesn't want to open properly, and so is kind of obstructing some blood flow that goes through. And so kind of placing a balloon in the heart, or through that pulmonic valve and inflating it so that, the valve will pop open and blood flow will go through better. And so actually that picture that you're seeing on this slide, I'm the gowned person in the middle, and obviously 2 very skilled cardiologists standing in between me, and I am getting to assist in a balloon valvuloplasty. I was able to do that a couple of times, and more so just holding wires for doctors and not really doing the nitty gritty, but it was still a very amazing opportunity to be able to scrub in and kind of be on that side of the table. And during these surgeries, the technicians are always in there and, we're opening sterile equipment for them, making some measurements on the fluoroscopy equipment that we have, because, obviously the doctors are sterile and they can't touch the screens or anything where we're making the measurements. So just being able to help them in that way and understanding where they're measuring and why they're measuring, took some studying outside of being in the procedures, just so I could be prepared for them, and be able to assist them whenever they needed. And then in being in cardiology, we also did pacemaker surgeries, which was the only one that was, kind of on a more of an emergent basis. You never know what one was going to come through the doors on the emergency list. And obviously we need to get their heart rates back up in a timely fashion. So just being able to help with those were always the more intense ones, because they were an emergent basis and we're dealing with the heart and its beating function. And we also did, we did the basic technician skills, drawing bloods. We do ECGs, running those so that, we can at least run the ECGs and get the documents that the cardiologist will need to take a look at so that they can write their reports. And so I really appreciated my time. I was in the cardiology specialty for, I think, about 6 years, and just really enjoyed my time there, enjoyed learning about the disease process, and really found a passion for it. And then, kind of as time was going on, I was faced with the question of, where do I go from here? I started off in a more generalized area of the hospital and then went into a specialty, and, kind of what's my next step for growth in my career, and where do I see myself? And I kind of had two options, really. One would be to go and gain my VTS certification, which is the next step after the CVT. And so, I could have specialized in cardiology and gotten my VTS, or, looking into the management side of things. And it just so happened that as I was trying to make this decision and kind of decide where I was going to go, there was a management position that opened up that would actually be managing the cardiology service as well. So it kind of felt like I should take this opportunity and see how I liked it. How I could grow my career and what other skills I could learn. So I did end up moving into the manager of the specialty services, which is where I am currently. I've been in this position for probably about a year now. Yeah, it was a year in February. And so as you can see, you can kind of see my list of my duties now, and it is considerably different from being a technician on the floor. Not to say that I still don't go down and help to be on the floor. At the beginning, I realized that I wasn't seeing as many pets or patients every day. And so I had to make a rule for myself that I had to go down at least once, if not 2 or 3 times a day, just to, pet a patient who's scared, or, comfort an owner or something like that, just because I did miss that portion of my job. And so, now I deal with schedules and hiring for the departments. I also have, not only do I work with the cardiology service, but I'm also the manager of the avian and exotics department, as well as the internal medicine department. And so I have been able to learn different skills here. I've never really had to conduct an interview before, or, deal with a budget, and help write hospital policies, and, learn the equipment that everybody uses, and how do we troubleshoot when it breaks, and who do I talk to in order to get it to be fixed. And then I'm still a mentor to all these technicians that I am in charge of, and, helping them in their journeys. Are you interested in VTS? Is that your main goal? How can I help you get there? You're a new technician, let's find you some time to go train on how to do phlebotomy or restraint techniques. And so just mentoring these younger technicians and kind of helping them grow their careers, and being a sounding board for them and giving advice when they need it. And so it's, I've definitely kind of seen all of the different aspects of veterinary technology, and I do enjoy where I am now, but I still do miss being on the floor more often. But like I said, I've kind of managed to get my fix in and make sure that I go down, several times throughout my day, to still be involved with the patient care, because that is still a passion of mine for sure. And I'm happy to answer any questions. Please feel free to reach out. That's kind of my journey, and I don't know where I'll end up, but I'd like to see myself here for many years to come, and continuing to mentor younger technicians, and, build all of these departments and advance them as along with the veterinary medicine world, and maintain that standard of high practice that Angel carries. I did have to put in a picture of my beautiful pup. This is Stella. But if you have any questions, or if I can help in any way, give any advice, please don't hesitate to reach out. I've left my email address here. And as always, I'm happy to answer questions about my journey, give advice as to where you might want to take your journey, or even just questions about Angel in general. Shameless plug here, we're always hiring. We're always willing to give tours, and just come and shadow if you're interested. We have, just to list some of the departments, we have neurology, dermatology, ophthalmology, cardiology. We have a great diagnostic imaging service that does, CTs and MRIs. We have an radioactive I-131 program that's very busy dealing with cats and hyperthyroidism and helping fix that. And as always, obviously we have an amazing inpatient and critical care unit that helps deal with all of these emergencies that are coming through the door. And always teaching. Something that I have come to love about my job is that I am guaranteed to learn something every day that I'm at work. Whether it be now, learning something new about equipment, or, back in the days when I first started of, learning restraint and doing the triage and listening to the criticalists and the senior staff doctors teach the interns and residents. There's just an endless amount of knowledge. So we welcome you to come shadow, apply for a position, everything like that. But please feel free to reach out. Again, my email is right there, and I'm happy to answer any questions. I hope you enjoyed my journey through veterinary medicine, and please reach out if any questions. Thank you so much.